Well, tracking the COVID-19 vaccine, new supply lines could soon be available for the Palmetto State. Today, DHEC talked about the Johnson & Johnson vaccine. Now, if approved, it could increase the state's weekly allotment of doses. Now, this news comes as delays continue to happen and will likely be an issue this week due to the winter weather.
Fox Carolina's Matt Koufax joining us live outside Brio Internal Medicine in Greenville with what upstate doctors say increased vaccine supply, can mean for their patients.
Yeah, guys, well, doctors at Brio tell me that they are still waiting for the vaccine. They say they have the capacity. They just need the doses. They are actually still vying for the vaccine like many local practices throughout the upstate and the country. Meanwhile, the Biden administration does say that the Johnson & Johnson vaccine will be available for authorization in just a few weeks. DHEC Senior Deputy for Public Health Nick Davidson says there are still a lot of questions when it comes to the supply of the Johnson & Johnson vaccine.
We expect the week before shipment that we will find out the number of doses that we will be able to order.
But he says regardless, it's reasonable to assume that overall supply will increase. This is good news for doctors at local practices like Ann Mead of Brio Internal Medicine.
Our patients are calling, requesting the vaccine. It's been hard and difficult for us to say we don't have it just now.
Mead says it's been an agonizing wait since they applied for the vaccine back in November, but this could mean they finally get a share.
We do have the capacity. We have the freezer and the refrigerators needed for the vaccine.
She adds she wouldn't hesitate to give it to her patients.
The option of having the Johnson & Johnson vaccine will decrease risk of COVID infection and decrease severity of infection.
Finally, DHEC also reminded the community today that they want people to get both doses of the vaccine at the same provider to avoid confusion and over-ordering doses that goes to waste. Mead says local practices like hers know their patients well and have their trust, and that they can easily identify who qualifies to be vaccinated at what time.
If we had the vaccine, patients would feel confident having the first dose and the second dose with us.
DHEC also told the community today that the Pfizer vaccine, Pfizer obviously responsible for one of those initial doses that we are all so familiar with at this time, they say that their new vials are going to be able to contain 6 doses worth of COVID-19 vaccine as opposed to 5 doses, which is what it was before. Mead says that she's sure many other doctors would agree will take any type of new influx they can get. In Greenville, Matt Koufax, Fox Carolina, the 10 o'clock news.
Matt, thank you. And we'll have continuing coverage for you right here on Fox Carolina all about the pandemic.